I'm Dr. Sakshi Sadhu, Deputy Medical Director, Outpatients at Universal Hospital, Abu Dhabi. I'm a general practitioner by practice. Today we will be discussing about disorders of the thyroid. Now, why are thyroid disorders of clinical significance? It is because of the following important statistical data. Number one, thyroid disorders go asymptomatic. A lot of us walk into the clinic without knowing actually that we suffer from thyroid disorder. We do a random blood test and we see that there is an abnormality in the thyroid profile. Number two, around 1 in 8 women suffer from thyroid disorders. 5 to 8 times this disorder is common in females compared to men. Now let's also understand there's a condition called congenital hypothyroidism. It's a disorder which is seen at the time of birth. If a child is not able to grow properly, if he is not feeding well, or if there is some form of lethargy, this condition could be congenital hypothyroidism, and therefore we need to check the levels of the thyroid of the child at that early age. Also, there's a thing called endemic goiter, a disease condition which is prevalent in several communities which are devoid of iodine element in their diet. These could include places of Southeast Asian region, perhaps northeast parts of India, and also some regions in America where there's deficiency of iodine in diet. When iodine levels go less than 50 micrograms in your diet, there is a possibility that you may be suffering from goiter. Now that we've understood why this data is statistically important, we should also understand that there's a chance that sometimes the swelling in your thyroid could also mean cancer of thyroid. Out of all the endocrinological disorders, the disorders of thyroid and cancers of thyroid prevail. Of this, papillary cancer tends to be the most important one. So let's now talk about what actually thyroid is. Thyroid is an endocrine gland. It is located at the base of your neck. It has two parts, the right lobe and the left lobe. And it is responsible for producing a hormone called the thyroxine hormone, which is of two types, T3 and T4. Now, what is this thyroxine hormone responsible for? Thyroxine controls the basic metabolic rate of your body. What does that mean? It means the day-to-day rate at which your body functions. For example, you're on the road and you're driving on the motorway at a speed of 100 miles per hour. Now that is safe. If you decide to drive at a speed of 200 miles per hour on the motorway, that is surely dangerous for you. Similarly, a disease condition called hyperthyroidism means hyperactivity of the body, driving at a faster rate. Hypothyroidism, on the other hand, means a slower rate of the body, pretty much like driving at 40 miles per hour on the motorway. So either of these conditions can be dangerous or harmful to your body and different parts, because it can lead to conditions which could be abnormal for your heart. Heart could slow down or move at a faster rate. Something wrong can happen with the nervous system. Sometimes people get hyper-exaggerated about certain things. People can be in depressed moods. Bowel activities could become hyper or slow down. Menstrual cycle could be affected. Fertility can be affected. And several other complications can occur in the body, which is why this disease is important. Now let's talk about the 3 important diseases of the thyroid. The first one being goiter. What is goiter? Goiter has been defined from a Latin word which means throat. A swelling in the throat is what is called as goiter. Why does goiter occur? As we discussed that there are certain endemic areas in the world which have less iodized or iodine content in their salt, or perhaps the diet that they take, and that can lead to goiter. Otherwise, you can see people with this big swelling in the neck, which could possibly be goiter. And in this condition, when the thyroid enlarges, there could be abnormal functions of the thyroid also sometimes. And what do we do in cases where this patient is suffering from hypothyroidism or hyperthyroidism? Hyperthyroidism is a state where the body or the basic metabolic rate of the body is working at a very, very fast rate. What do we do in such patients? And actually, why do these patients get this problem? The most common cause of having hyperthyroidism is Graves' disease. Graves' disease is an autoimmune condition of the body. What is autoimmune? Autoimmune means when your body decides to fight, the body's immune system decides to fight against its own cells. And when that happens, there is high amount of thyroxine produced in the body, and the body goes at a scale of 200 miles per hour on the motorway. So the patient can present and often comes to us with, "Doctor, I have lost a lot of weight even though I'm having good diet." Well, that's because you may have hyperthyroidism. Patients come with changes in their menstrual cycle. They may have less amount of bleeding during their menstrual cycle. They may have fertility issues. A lot of patients come and say, "Doctor, I'm not feeling well. Every day I'm very tired. I don't sleep properly. I'm always anxious. And my heart, I feel something, chasing in my heart." And what is that? That is palpitations. These patients often are always tired, and that is what hypothyroidism is. Hypothyroidism could also be caused by other things like drugs, like amiodarone, or it could be caused by perhaps radiation. Now let's look at hypothyroidism. Hypothyroidism is totally opposite to hyper. Hypo means to slow down. So it's like driving at 40 miles per hour on the motorway. When you do that, patients suffer from constipation, the heart becomes sluggish and slow. These patients gain a lot of weight despite the fact that they eat normal diet. They're often very depressed and suffer from psychological problems. They have irritability, they have a lot of muscle aches and weakness in their body, complain of a lot of pain, and a lot of menstrual irregularities happen in such patients. They tend to, have more bleeding, and again, fertility issues can be a problem as well. Their skin becomes rough, they have a lot of hair loss, and these are some of the problems which a hypothyroid patient can present with. A lot of times, patient also says, "Doctor, I'm not able to tolerate cold weather," whereas a hyperthyroid patient may say, "Doctor, I cannot tolerate standing in the heat." So these are some of the symptoms these patients suffer from. And why do patients get hypothyroidism? Again, the most common cause is an autoimmune cause, which is called Hashimoto's thyroiditis. The second would be possibly post-surgery. A lot of patients, what we do is we remove the thyroid gland. We do what is called as thyroidectomy. And post the surgery, patients develop hypothyroidism. So we need to give them supplemental thyroxine. Some of the other conditions that can cause hypothyroidism could also be medications. We need to understand what are the investigations that we do for such patients and what is the treatment management. Investigations. First, we will do the blood markers. We do what is called as your thyroid profile and check for your thyroxine hormone and a TSH hormone. And depending on that, we can say whether you're a hypo or a hyperthyroid state. The second is, because we've now come to understand that a lot of these problems are autoimmune in nature, where body's own defense mechanism fights against its own thyroid cells, we need to check for your thyroid markers and antibody markers. Next being, we also sometimes do a thyroid scan. We could do a thyroid uptake scan or a normal scan where we see whether there's any lumps and bumps in your nodules and how much of iodine uptake is there in your thyroid. And sometimes some surgeons do sometimes see all these chances of or probability of malignancies in thyroid or thyroid cancer, in which case we do what is called as an FNAC or a cytology, where we just take a sample of your thyroid and see whether it's a benign or a malignant condition. It also helps us to define the prognosis and treatment of the patient. Let's now get on to the treatment. The treatment of these conditions could be three types. It could be a normal management, a medical management, and a surgical management. What's a normal management? Say, for example, patient doesn't suffer anything, asymptomatic patient, borderline thyroid levels. We say, okay, we will see, we might review in 3 months, and you can come back to us later. Alternatively, if the thyroid markers are abnormal or the patient is symptomatic severely, we may give the patient thyroxine if the patient is suffering from hypothyroidism, or anti-thyroid drugs like carbamazole if the patient is suffering from hyperthyroidism. Some cases of hyperthyroidism may also require surgical management if they are not controlled, in which case we remove the thyroid gland and do what is called as a thyroidectomy. So even for some malignancies, we have to remove the thyroid, or we might even have to do a chemo or a radiation therapy. So that is what the team is all about. It is about medical management and your surgical specialists also getting involved in this as a team and solve the problem of thyroid diseases. So having said that, I hope you've understood what is the importance of thyroid disorders and the fact that thyroid disorders are to be managed properly and you're supposed to get a regular follow-up with your physician timely. Lastly, as Deputy Medical Director Outpatients, it gives me extreme privilege to share with you all that we at Universal Hospital are launching a thyroid clinic very shortly just for you, where a team of our medical and surgical specialists jointly will handle your problem. Come and get yourselves treated right away. Thank you.